This is an interesting question. In Oklahoma, the ADRC has put disability and aging together. Are we the exception, or is ADRC not going to happen? Is it going to happen nationally?
My brief history of the ADRCs. ADRCs are a concept that originated in the state of Wisconsin. Started, I think, as I've talked to advocates at the state level, where they have been working collectively. The ADRC is a county-based program as the single point of entry. Secretary Tommy Thompson, former governor of Wisconsin, he was the secretary at HHS, was strongly supportive of this collaborative approach. It was really under his leadership that he wanted the nation to move forward with an ADRC approach. It was codified in the 2006 reauthorization of the Older Americans Act. So no, it's not going away. It's been codified in law. AOA has been has been implementing this ADRC concept with mixed results. And I don't think, and I came to AOA after this concept had started, I hadn't really figured it out very well, even when I was in Kansas. I know, but I see my mistakes I made in the past. I can understand the concept much better at the local level. The AOA didn't get it all right, but didn't get it all wrong. But it still needs tremendous work. There are places in which the partnership between aging and disability by way of the ADRC is very successful. I've been on the road, North Central Texas and Belton, Texas, earlier this week. They have been working in this way. There are other places in the country where it has not worked. The major shortfall or problem in the ADRC is that because of the path that it took, as I described those roads, it came down an aging road, and it has a D in the name. And when you talk to people for Centers for Independent Living, for example, they've always served people of all ages. So I have been quite public in speeches the whole time I've been assistant secretary. What is the best way to give meaning to the D so that it's true collaboration at the state and local level, so that there's opportunity for funding disability in the ADRC? It will be easier for us to move forward in that analysis as the Administration for Community Living. What I hope to be as an aging advocate is the partner that the disability communities hope to work with, to honestly come to the table as an honest broker and say, I'm willing to vision a slightly different role or outcome for ADRCs, but I cannot do that alone. If the critical issue is the D, and I come from aging, so we must do that together. And I think they are here to say we have a lot of conversations right now with CMS about the future of ADRCs, and a lot of conversations with the Veterans Administration. It's a critical, new, funded partner who will also, I think, start looking more at ADRCs as an access point for their services as well.